What if we could save a life with just a conversation? Before answering that question, we first need to understand what really defines the act of suicide. Suicide is a universal phenomenon affecting individuals across all cultures, races, genders, and socioeconomic statuses. Despite its wide-reaching impact, core elements of suicide assessment remain consistent across different groups. Surprisingly, standard training in suicide assessment is not uniformly integrated into accredited mental health educational programs, despite suicide being a leading cause of death in various age groups. We need to be really careful about the language we use when discussing suicide. Terms like committed and completed suicide should be avoided because they have been historically used in other contexts and can communicate unintended implications. For example, committed goes back to the time when suicide was criminalized. The word completed suggests an achievement. Instead of using these words, we can use phrases like died by suicide, which is a more respectful and sensitive term. Understanding why people suicide is complex. The Interpersonal Theory of Suicide, ITS, gives us some useful insights. This theory highlights three critical constructs: thwarted belongingness, perceived burdensomeness, and the acquired capability for suicide. In other words, some people may unfortunately feel socially isolated, and over time, they may develop a sense of being a burden, primarily the burden for the loved ones and the family. Imagine someone who has experienced a lot of emotional or physical pain over time. Gradually, they might start to become less sensitive to this pain, and the natural fear most of us have of hurting ourselves or facing death starts to diminish. This isn't about bravery or courage. It's more like a numbing process that happens after prolonged exposure to painful experiences. For your loved one, this could mean that if they've faced traumas, severe stress, or even previous self-harm, they may have developed a higher tolerance for pain and less fear of the consequences of their actions. This doesn't make them weak. Rather, it's a psychological response that can happen to anyone who's been through a lot. It's also important to remember that this capability alone isn't what leads someone to act on suicidal thoughts. It's typically combined with intense emotional distress, a sense of not belonging, or feeling like they're a burden. Our focus here is to understand these feelings and experiences so we can better support and protect them. Being aware of this concept helps us to be more attuned to their needs and to recognize the importance of addressing not only their emotional pain, but also their sense of safety and connection to others. Our understanding, empathy, and willingness to be there for them are very powerful steps to help our loved ones feel supported, connected, and valued. In the United States, suicide consistently ranks as the 10th leading cause of death across all ages, and second for those aged 15 through 34. Patterns observed include a higher suicide rate among men, particularly white males, with firearms being the most common method. Geographically, suicide rates are higher in rural areas compared to densely populated regions. The scientific inquiry into suicide began in the late 19th century with Morselli's pioneering observations, followed by Emile Durkheim's groundbreaking work, Le Suicide, which set the stage for modern suicide research. These foundational studies identified enduring risk factors such as social isolation, a theme still central in contemporary research. Over time, the scope of identified risk factors has broadened significantly. Modern scientists examine the role of well-recognized elements like PTSD, depression, and anxiety, but also less conventional ones such as breast augmentation, gender, sexuality, race, and rural residency. Today, the emphasis in suicide studies has shifted towards understanding the totality of human experiences, recognizing that almost everyone may possess some risk factors. Suicide risk identification emphasizes interpersonal factors. Let's talk about thwarted belongingness. Thwarted belongingness may arise among people who are unable to form or maintain relationships and deep connections with others. Also, it may be caused by major life transitions such as moving, incarceration, or job changes, which may lead to suicide in some cases. The loss or absence of reciprocal relationships, like in divorces or deaths, significantly contributes to this feeling. Additionally, there is an increased risk of suicide among those bereaved by suicide. Some people may experience complicated grief that often involves feelings of self-blame and stigma. Perceived burdensomeness arises when individuals feel they are a burden to others, often due to chronic illness, disability, mental health issues, or financial dependence. Social isolation and cultural factors can also play a role. This feeling is common in the aging people and those experiencing long-term unemployment, leading them to believe their existence is a strain on loved ones or society. Intrapersonal risk, or the acquired capability for suicide, is linked to an increased tolerance for pain and a diminished fear of death. This can develop from experiences of victimization, such as child abuse or intimate partner violence. Physical health issues, including serious illness and sleep disturbances, also contribute to this capability. Certain professions, like those in medicine, law enforcement, or military, may increase pain tolerance and reduce the fear of death due to regular exposure to pain and suffering. It is important to note that while acquired capability is a significant factor, the presence of interpersonal constructs like thwarted belongingness and perceived burdensomeness is also necessary for suicide risk to escalate.